Thank you, Presiding Officer. I start by reminding members that I am a registered nurse, former clinical educator and perioperative clinical practitioner. And of course, it is important to reduce NHS waiting times. And, for an example, the complexity of working for me in the perioperative environment in theatre, it's a complex environment which requires specialist surgical teams, consultants, surgeons, anaesthetists, nurses, perioperative support workers, as well as ancillary coordination with labs, blood banks, radiology, and everyone requires knowledge, skills, competency and training. And everyone working in these areas and across the NHS must be commended for their commitment to providing the best care for their patients. Tackling waiting times is no easy feat. Presiding Officer, the Scottish Government is choosing to invest more than £19.5 billion in health and social care in 2024-25, giving our NHS a real terms uplift despite the UK Government's austerity. And this does include a £14.2 billion of investment in our NHS boards, with additional investment of over £500 million. And it is worth noting that NHS Dumfries and Galloway and the Scottish Borders in my South Scotland region are receiving a real terms uplift in funding. And of course, this is not without its challenges, though. I think it is worth noting that this current budget, passed by this Parliament, will do more for our NHS. It provides an additional £230 million to support delivery of the pay uplift to a minimum of £12 per hour for adult social care workers in third and private sectors from April 2024, representing a 10.1% increase for all eligible workers. It also invests in over £2.1 billion for primary care to improve preventative care in the community, supporting the development of multidisciplinary teams in general practice, sustaining NHS dental care through enhanced fees and continuing free eye examinations. And it supports spend in excess of £1.3 billion for mental health services, for which there is an ever-increasing demand. These are welcome commitments given the current strain on all budgets due to economic mismanagement from Westminster. However, Presiding Officer, despite this investment, the system is under extreme pressure as a result of ongoing impacts of pandemic recovery, Brexit and inflation, and UK Government spending decisions. So I welcome that the Scottish Government will continue to target resources to reduce waiting times, particularly for those waiting longest for treatment, through maximising productivity and additional resource. Investing in Scotland's NHS is non-negotiable for the Scottish Government. And against the challenging economic and financial context, the Scottish Government is taking the difficult and necessary decisions to ensure continued investment in health and social care services. The UK spring budget was nothing short of a betrayal of public services across the whole of the UK, and the budget provided less in Barnett consequentials for health than in-year health consequentials of 2023-24, and it's failed to deliver more capital funding for infrastructure. And based on the latest forecast, Scotland's block grant for capital is now expected to reduce in real terms by £1.3 billion by 2027-2028. And I know time is short, Presiding Officer, but I was interested to hear Carol Mochan when she said she was proud of her party that created the NHS. Well, I wonder if she's proud of Labour Shadow Health Secretary saying that he would hold the door wide open to the NHS for the private sector if his party wins the next general election. Presiding Officer, we have major challenges in our NHS with lots of things to consider, but the threat to Scotland's NHS that comes from Westminster parties of all colours is going to be damaging for us in Scotland. But if we had independence, we'd be able to manage much better. Thank you.